I'm Marianne Martindale, the Executive Director, and I'm going to introduce Dr. Chad Spain, who is our current board president, but he also is going to be one of our presenters today. And with that, I will turn it over to Chad.
Thanks everyone who is listening. My goal with the first part of this talk today is to discuss what I wish I had known as a young physician. Marianne and Barb came to me with this topic, and they thought, well, I was still new enough out of residency to be able to provide some practice tips, some things to look for when you're hunting for a job, how to keep yourself happy, how to set up the practice that you've always dreamed about, and also how to help prevent burnout along the way. So when I started thinking about this topic, I ended up coming across a number of kind of key areas to focus on. So over the next little while, I'll talk about different items with job details, with lifestyle things to think about. I want to draw people's attention to the patient population that you either want to see or that you might be seeing with whatever job you take as a new physician. I want to remind you that you start to have some power and that you can say no to different things. And so we'll go into details there. We'll talk a little bit about other ways you can become involved as a young physician, not just with your day job, but if you have other passions, things that you can do that can help with mental health or help achieve you whatever goals that you want. One other item that's not up on this list is trust. And there's a couple of instances that I ran into that ended up being mistakes. And my hope is that people don't make those same mistakes if I can help guide you there. So we'll go ahead and start with job search. So this obviously would be geared a little bit more towards residents at the end of their residency program, but there are a number of areas here that I would want to have people keep in mind and things that I wish that I knew. And I'll preface this by saying that it's okay to be a bit demanding when you're looking for jobs. And I would encourage you to ask questions. No longer are you in a position where you really have to, I don't want to say impress because it's not the right word, but as you go through undergraduate, you're working to earn top marks so that you can get into a good medical school. And during medical school, you do scout work on rotations and you spend time writing notes and you are studying so you can get into a nice residency program. And then you work hard during residency so you can learn, but entering into a new job field, you start to finally have some power in this, and don't relinquish that. So there are several factors that you should think about before looking into a job so that you can ask these questions and be prepared to set up the practice that you've been dreaming of over the last decade. So the first one would be your work schedule expectations, and you're going to see such a drastic variety depending on where you apply. Personally, for me, Intermountain Healthcare, where I work for now, they have me working 4 days a week. And it's okay to ask that question of what days you're expected to work. If you are expected to see patients on the weekends or work after hours clinics, you're not going to know unless you ask, and you should be asking these questions. Call schedule is huge. We'll talk a little bit about how this plays into lifestyle later on, but it's really important to dive into details about call schedule. Is your call phone call only? Do you have to potentially go into a hospital? Are you expected to deliver patients? Are you expected to take care of newborns when they're born? How frequently are you going to be on call? Do you have a nurse that can triage a lot of your phone calls? Do you provide refill requests over the phone so that hopefully you're not refilling Adderall prescriptions at 3 a.m. on a Saturday morning and staying up all night through your call? So all of those things are very important to consider, especially as a new doc when you're looking for a job. Expectation of your template and the number of patients that you see is an obvious one, but you have to ask detailed questions about this. And this is something that I wish that I did when I started. They may tell you at the beginning of your contract And Mike Blackburn will talk to you about this at the end of this presentation, about what your expectation or what their expectation is for you, whether it is a volume based, like work RVUs, a fee for service, where they expect you to see X amount of patients per day. They may mention what they expect out of you for the first couple of months, but what's their expectation of you at the end of 1 year or 3 years or 5 years? What I found is that number drastically increased of what they expected out of me. And if I didn't hit those numbers, I wasn't going to receive my bonuses or my pay. I didn't know to ask that, but it's important to ask that. Furthermore, if you're working in a value-based program, how do they determine value? Oftentimes, if you're working in that type of practice management, you're getting more time to see patients, so you're not seeing as many patients during the day, but you're expected to take good care of them and keep them out of the ER, keep them healthy, and that's how you end up saving the organization money. So the place that you're looking to apply for, how do they measure that? And what do they expect out of you? That ties directly into who will structure your template. And a lot of these things may sound obvious, but it is so critically important to ask about these for your livelihood and your well-being and what you want out of your practice and your happiness going forward as well. Do you have complete structure over your template? Do you get to decide how many minutes you get per visit? Or does the organization or company that you work for plug you into 15-minute slots and that's what you're expected to do 4 or 5 days a week for potentially the foreseeable future? That really will drastically change your view of medicine and your outlook on the world and your job. Some companies will have support for documentation and billing. This is not exciting, doesn't excite me in the slightest, but it's always nice to know if your organization will have support if you have questions on how to bill, or whether or not your documentation is adequate, or what do I need to document for those Medicare annual wellness visits. Ask and see if the place that you're applying for will give you support with it. A lot of organizations do, and you may not necessarily know about it unless you ask. One of the final big things about job details, and I think that this could be a presentation on its own, but is pay. It's okay to ask about this. Coming out of residency and even during medical school, I always felt like pay wasn't talked about. It's talked about in every other profession known to man. Anytime anyone else out in the world looks at a job, they're going to be expected to know what they're getting paid, and we should be no different. And it's okay to ask how your pay structure will be set up. Is there room for it to grow with time, or is it going to stay stagnant? Is there opportunity for incentives if you meet quality measures? Those things are important. One big one that I put on here lastly is, can you incentivize staff? So this seemed like a small item, but for me, it was a really big deal. Our medical assistants within my organization, I felt like they were underpaid and overworked, and I still feel like they are. And for holidays and certain times of the year, I wanted to be able to provide them with a bonus if they worked hard. And what I found out very quickly, we weren't allowed to do it for a number of reasons. And so if that's something that you see as important to you, it's worthwhile to ask. And so I guess the moral of this story, so there's lots of fine details here, but if you have a question, don't be afraid to ask it. All right, that's the first part. Part number 2 of what I wish I knew is about lifestyle. Remember those people you used to hang out with before the past decade of your life that you sacrificed to medicine? Well, they might still be around, and they may still want to see you again in the future, and you're actually going to have time to see them. And so those hobbies that you used to enjoy doing, the friends that you had, the family members that haven't seen much of you, you might end up having some time to spend with them, and that's okay. I remember the first few months coming out of residency and into practice, being done with my charts, being done with my patients for the day and getting home, and just having that feeling of anticipation that I should be doing something different. I should be preparing for the next grand rounds or completing the assignment of the rotation that I'm in or preparing my next research paper. If your job doesn't require that, you're going to have some extra time. And so what I would encourage you to do for your mental health is embrace that free time and start to reach out and do those things that you used to enjoy. It's going to help out with burnout in the long run. And I gave you some different thoughts here. If you want to run a side business, go for it. That's okay to do as well. You're going to have some free time. So start to think about how you want to spend it. Or if you don't want to spend it at all, you say, hey, I want to relax and sit down and watch Netflix for the next 6 months. Hey, all the more power to you. We'll talk about the bottom piece here with taking advice with caution in a future slide. Patient panel. This is a huge one, in my opinion. It's very important to consider when you're looking for your job, what type of patient panel you will be seeing. It's important to ask the question if you're going to be inheriting a patient panel or if you're going to be starting fresh on your own. Those are two very different pathways. If you're inheriting someone else's patient panel, I would really encourage you to dig and find out as much as you can about the patient panel. Why did the previous provider leave? Were they burned out because they had some difficult patients that they had to work with? Is a majority of their patient population geriatric? Is that something that you want? Because if not, that may not be a good fit for you. Is that patient population young and pediatric driven? Well, maybe that's something that you love and it works out great. But this will matter. If you're inheriting patients who are sick and complex, and you have a couple of thousand patients on that panel that you're expected to take care of, well, it could be challenging. Maybe it's something that you really want, but it may also prove to be tough. And so that's something you're going to want to know about going in. I didn't know to ask that question when I took my first job, and I inherited what I felt to be a very complex panel. And it was tough. I did not know what I was jumping into, and I wish I would have asked. In the same topic, but a completely different path, is whether or not you would be starting fresh and growing your own panel. Some clinics are looking to add more providers because they simply don't have enough providers to care for the community around them. And in this instance, you really have the opportunity to shape your practice into what you've dreamed of over the past 10 years. In this situation, I would encourage you to think about, those times when you say, gosh, when I have my practice, I would want to do this, whether it's really be an advocate for contraception or seeing newborns when they're in the hospital or doing procedures and injections. If those are things that you enjoy doing, promote yourself. Put flyers on the wall in your clinic room. At the end of every clinic visit, if you have a woman of childbearing age, mention to her, hey, if you ever want to talk about contraception, please be sure to come back and chat with me. You see an elderly person who said that they went in to see their orthopedist for an injection. Well, mention to them, hey, I can take care of that for you. So don't be afraid to think about what you want out of your practice. And furthermore, definitely don't hesitate to promote yourself and advocate for yourself. It will take time for that panel to shape, but that effort is absolutely worth it because those are going to be your patients for years going forward. Lastly is expectations for patient panel. So this is kind of taking a step back and more looking at the job details when you're out on the job hunt. But it's very important to know these factors that I listed on here. Are you expected to deliver? Are you expected for newborn coverage or to see geriatric patients, or pain medication management? I was very close to taking a job coming out what I thought was a full spectrum family medicine practice. Didn't have OB, so I should retract that part. But it wasn't until one of my final meetings with the group when they said, oh, by the way, in the next year or two, we want you to be taking over addiction medicine services, which I didn't feel like I had training in and wasn't something that I imagined myself doing. But I hadn't asked the question if they expected it out of me. It wasn't until they threw it in there at the last minute, and I ended up not taking that job. So be sure to ask about these things. Whether you want them or not, it's important to know what the expectations are up front so that you don't get yourself into a position that you don't want to be in going forward. Say no. So you can say no. This is great. As I mentioned earlier, there's a lot of things that you had to do to get to the spot that you're in now. Some of those things you want to do, some of those things you would rather never do again in your life. And those items now, you don't necessarily have to do those going forward. The first point that I have on here is with medication. If you say, hey, I don't want to manage testosterone or opiates or stimulants, you don't have to. And that's okay. But think about those things up front. And as you go through residency, you have so many different things that are going on that you may not necessarily sit down and think about what you want your practice to be built like in the future. But I would encourage you to think about those things now, because these may not be things that if you don't want to deal with them, you don't have to in the future. Promotion of yourself in regards to injections, procedures, mole removals, those are things, if you want them, advocate for yourself. And if you don't be afraid to say no. Just because a patient comes in and says, hey, I need my 300 oxycodone refilled, you don't have to say yes. And of course, you want to work with them. You want to find out what the underlying issues are, and you don't want to harm your patient, of course. But in the long run, if you don't want to be someone else, you don't have to. Frequency of appointments is an interesting one. This is one that I really didn't have any concept of. No, I shouldn't say that. I didn't have a great concept of coming out of residency as far as my hypertensive patients, how often I expect them to come back and be seen. They may have been seeing a previous doctor who said, oh, I want you in every 3 months, and other doctors who say, oh, I want you in once a year. Well, you can form, based off of your training and evidence-based guidelines, what you want that ideal frequency to be, and you can set that, and that's completely okay. Something that you may not think about otherwise. The last point on this slide, I think, is one of the biggest things that I want to drive home. And that's having family and friends as patients. And I remember during medical school being told that we shouldn't have family and friends as patients. And I've kept with that with family. But with friends, I didn't follow it, and I should have. And every one of you should follow this as well. And I'll give you a story to illustrate this. So I'll try and make this brief. I had been seeing a number of friends coming out of residency. I figured, hey, they stuck by me. Why not, be there for them when they need it, to provide them with visits and give them quality medical care. Well, one of my friends was seen, I was out of town. He was seen by a colleague of mine and diagnosed with pneumonia or sinus infection. He was given an antibiotic and sent home. Well, a couple of weeks later, in the middle of clinic, he had sent me a text and said, I am not doing well. I need to be seen. Well, that presents its own challenge because he's got my cell phone number, which I gave to him, and told him that he could always feel free to reach out to me. Well, he comes into clinic, he gets in, and he looks awful. I'm up on the 4th floor in my clinic. He said, I can barely walk up the stairs to get to you. And this is someone who was previously healthy. And immediately I knew there was something wrong. So I do an exam. He's got a sore throat. He has lymphadenopathy. He opens his mouth. The worst case of thrush I've ever seen. And immediately it hit me, and I knew what he had. So we do blood tests. The next day it comes back. His CBC is awful. His CD4 count is nothing. He has full-blown AIDS. Now, not only do you have to make that phone call to a patient, but you're also making it to a friend. And that's an incredibly difficult phone call to have and to make, to tell someone that you're close to that diagnosis is there. And then furthermore, you have to keep that inside, right? I mean, obviously with patient confidentiality, you can't let that go. And that's very tough. So I would really, really encourage you, tell your friends and family you love them. You tell them thanks for thinking of you to be seen, but I would really try to keep those two worlds completely different. Okay, involvement. This is a good one. So there are things outside of medicine that you can do to be involved. And these things can help with burnout. They can just fill the void that maybe the day-to-day clinic doesn't provide you. These things are out there, they're everywhere, and you can be a part of them in that free time that you're going to have, well, at least some of it. There are free clinics. There is the AFP and the UAFP. State medical associations can be great. The UMA provides great financial services, and you can go utilize them. School sports coverage, philanthropic events, organizational boards, those things are out there. They are everywhere, and really can be beneficial. I would really encourage that once things get settled, that if you are someone who wants to be involved in any of these outside things, and the list can go on and on, to not hesitate at all to jump into them. It really can be very fulfilling. And sometimes your day-to-day practice, once you get established, you can feel like there's something missing there. And being involved with your community can help fill that void. Last major point I want to make is to be careful. There are some people out there who will try to take advantage of you. And I fell victim to this. There are some organizations that are great and I personally feel are trustworthy. I feel like the UAFP and the AAFP have been great assets and advocates for when I have questions. The UMA Financial Services, I've had a great experience with as well. Mike Blackburn, who we'll hear from at the end of this, I had him review my contract twice and felt very confident with him. If not, this would have been fairly awkward. So I'm glad that worked out. The point that I fell into a trap, there are some organizations that will promote themselves as financial planners. My wife and I went to one. We said, hey, we're going to have some discretionary income and we have some goals and we want to find out how to meet them. Well, during residency, there are outside organizations that set up some fancy dinners for residents. You know, they'll give you food and they'll give you a financial plan. And so I went to go see one of them and I thought that's what I was signed up for. And 2 visits later, I walked out with more life insurance than I ever needed and was paying thousands of dollars a month into it. And it wasn't for months and months later, and this is entirely my fault. I signed up for this, but it wasn't for months and months later that my wife and I, we finally had some downtime and we're like, wait a second, this money we can't touch for a number of years. And that's not what we wanted. And what we found out is the person who we thought was a financial planner wasn't. They were an insurance salesman. We were had by their tricks. This was my fault. But the point is, I don't want you to fall into this trap. I went to a financial planner. I happen to go to the UMA Financial Services, who I have no ties with. That's just who I used. They reviewed it and they said, yep, this company, you're not the first victim of this, and to be careful. So the key point of this is to be careful. And I think the speaker, the doctor that we have coming up right afterwards, I think is going to be a perfect intro into this. So, in summary, things that I wish that I knew and advice that I would want for you to have coming out of residency going forward. You have a lot more control leaving residency into your new job than what you've had in the past decade. And so think about what you want and go get it. Don't be afraid to ask questions when you're searching for your job. You're going to have some free time. Think about how you want to spend it. Use that as good mental health and positive reinforcement to keep yourself balanced as you enter into the workforce. The patient panels matter. Don't forget to think about what your patient population is, what your patient panel looks like, and how you want to shape it. You can say no. And then lastly, involvement helps burnout. For me, it does. Being involved in those items that I mentioned before can be a great way to fulfill some holes.